Yeah, so this is I have mixed neuro
Uh-huh.
and ophthalmology because they have very few questions and toxicology.
Okay.
Okay, so I mixed them. Then
Okay.
the ophthalmology and toxicology is not that much of questions. So mainly
Uh-huh.
neuro. So but we just do those few toxicology and neuro questions. Okay. Okay, now 45-year-old woman with a QRS duration of 130. What's best next step after
Nothing.
intoxication?
Nothing. She's normal. Her QRS, not QT. Damn.
Yeah.
After intoxication, so calcium gluconate.
Sodium bicarbonate. This is a TCA intoxication.
Okay.
Yeah, that causes that. Now, 35 year. If you are a 35-year-old woman,
Mm-hmm.
uh, and you had a 7-year-old son who accidentally splashed unknown liquid containing acid on his face. So what should you do right now?
Um, well, where are you located? Home, office, where?
At home.
Um, call 911.
Yeah, this is just like wash the eye with copious amount of water. That's the first thing you do. And then you can call emergency 911.
So it was splashed in the eye, not on the face.
Uh,
Yeah, so that makes a difference when you say eye or face. Because
no,
eye, you
they
face.
said the way they mentioned it, they just said on the face.
Okay. All right.
Yeah, so they
I-
assumed that it's in there.
Hmm.
That's
Yeah.
how they worded.
Okay.
Now, if you're a 34-year-old farmer who present with 1 mm pupil bilaterally, abdominal exam shows increased bowel sounds and muscle fasciculations on
Mm-hmm.
extremities. Heart rate is 50. So, what do you think what should I do right now? Okay, I found your cloth soiled with vomit.
Yeah. Or I think yes, organophosphate poisoning. So you should give him pralidoxime and atropine.
Mm. Yeah, yeah, you're right. First thing, you remove the cloth and wash the body, and then you do these things.
Then you do what?
Then you give those pralidoxin and atropine. First, you just take out the cloths because if you keep the cloths, it's gonna worsen the poisoning more. Now, this is very important case actually. I'm gonna give you the clues that teenagers they were having an indoor barbecue. They so one of them developed headache, nausea, vomiting, abdominal discomfort. When you examined him, you find pinkish skin, pink skin. So what poisoning is that?
Yeah.
Yeah, CO poisoning. Now, if you're a 29-year-old male with profuse diaphoresis with a temperature of 102, and when I examine you, there is diffuse muscular rigidity with resistance to motion, is noted in all four extremities. So, what's your diagnosis?
This is a tough one. Maybe it's neuromuscular. Um, you have to give me choices for this one because I forget all the terms. But
Yeah, you're right. It's a neuroleptic malignant syndrome, diffuse
yes.
rigidity everywhere.
Mm-hmm.
Yeah. Have you had a case of a neuroleptic malignant syndrome, like in real life?
No.
Uh, So you treat it with stopping the neuroleptic and give him support hydration cooling, dantrolene or bromocriptine. Actually, today I had a question. It was very tricky.
Mm-hmm.
Mm, they said what medication that worsen neuroleptic malignant syndrome.
Worsen it, huh? I guess the neuroleptics.
Yeah, and they had no the answer the answer to options was levodopa, amantadine, or benztropine. Which one?
Benztropine.
Yeah, benztropine. Yeah, because they say it preserve it's anticholinergic, so you can't it preserve the heat inside the body, so that's why it's worse.
Mm-hmm.
Okay, now it's a good one. You're a 35-year-old woman firefighter presented with a tonic-clonic seizure and a heart rate of 115. Breath sounds bilaterally with scattered and expiratory crackles. Neuro exam shows some confusion. So after a burn, you were in a burn building, and then you came out with confusion. So what should I do now for you?
I'll give her oxygen.
Yeah, because this could be a CO poisoning. Give
Right.
her
So what is
hand.
the gas treatment? Can you go through those steps?
What is it? I'm sorry.
Go through the steps of the treatment?
Yeah, first you give her the oxygen, hyperbaric oxygen.
Mm-hmm.
Yeah, and that should take care of it.
Okay.
Because remove CO binding to hemoglobin.
Yeah.
Okay. But which one has higher affinity for hemoglobin, CO or oxygen?
CO.
Yeah, so CO more oxygen. So that's why you have to give as much oxygen as you can, hyperbaric,
Mm-hmm.
so that can displace CO as much as you can. And then you just monitor for at least 4 hours and
Mm-hmm.
hospitalize if they did not improve.
Yep.
So first you start them with a face mask oxygen. If that didn't work, then you do hyperbaric oxygen.
Okay.
Okay. And they have bright cherry lips. That's one of physical exam. They can have coma, syncope, heart failure, arrhythmia,
Mm.
dyspnea, headache, nausea. They can have everything.
Hmm.
Yeah, and the pulse ox is unreliable. Why?
Because it's not gonna, it's not gonna be low or anything. Because hemoglobin doesn't know.
Yeah, because it doesn't differentiate carboxyhemoglobin from oxyhemoglobin. So the pulse ox could be really good actually. Let me see if they give the pulse ox here. Mm. Yeah, actually they gave the pulse ox is 96%.
Mm-hmm.
So you don't rely on that. Okay, now that's a good actually these cases, wow, it's a good ones. Now, if you are a 32-year-old woman with slurred speech, difficulty walking, and you have history of headache, seizure, hypotension, when I examine you, I found 1 plus deep tendon reflexes and without nystagmus or hand tremor. So what's causing this issue?
You said no nystagmus?
Yeah. So you have slurred speech and difficulty walking and 1 plus deep tendon reflexes.
Yeah.
I can give you that you're lethargic too. You fall
Good.
asleep while I'm interviewing you. So what overdose is that?
Oh, overdose. Benzodiazepine.
This depends on that. No, good one. That's actually gonna give it away easily. So if you're a 27-year-old woman, there's a black suit is present near the patient nose and mouth. Black suit on your mouth.
Mm-hmm.
Yeah, what is that?
Oh, CO.
Yeah, CO poison. I can make it easier by giving you bicarbonate is 12, lactic acidosis. Yeah, so that's the think. So the anyone. So no, you said, what did you say? What poisoning?
CO, CO poisoning.
No, actually it's cyanide poisoning.
But you said there's black soot on nares and mouth.
Yeah.
Oh, so what? Wait, what was she near? Because that makes a difference. They have to give that in the question.
No, she's just unconscious. They just found it unconscious
Was she
at
next
at a
to
scene of
a
house fire, huh?
Okay. Yeah, they can get that too. Yeah.
Yeah, that's all what they described. They didn't give anything. And then they gave you acidosis picture. Wow, it's a tricky one. Damn.
Mhm.
So the management, you remove the cloth first, you do skin decontamination, and you give them charcoal. Okay? And then you give
Mhm.
them antidote. Which one? What antidote? That's an important one.
Um, Something with the TH, thiocyanate.
Yeah, like then these things, like if you don't review them, like you forget them like nothing. Yeah. Yeah, so you give them hydroxycobalamin. That's a preferred. That's the first line. And then if that didn't work, then maybe you can give them sodium sulfate as an alternative.
Mm-hmm.
But hydroxycobalamin is preferred. That's an antidote. What if the antidote is not available? You give them, that's
Wow.
a tough question. You give them nitrate to induce methemoglobinemia.
Okay.
Okay? And respiratory support, you shouldn't do mouth to mouth resuscitation. When you gotta
You,
supplement oxygen and do intubation.
you said you should not or you should.
No, you shouldn't.
Okay.
Because
So
this
just
is can transmit cyanide to you.
so you just intubate them.
Yeah. And then cardiovascular support, give them IV fluid for hypotension.
Okay.
Now I like ophthalmology, it's funny.
That's it for toxicology.
Huh?
That's it for toxicology?
No, I just had a few questions, selective questions.
Oh.
Yeah, there is left more, so it will come on our way too. Okay, now if you're yeah, so this is gonna come, it's mixed, yeah. So now if you're a 60-year-old woman, when I examine you, there's decreased visual acuity. Your left eye appear red with hazy cornea, shallow anterior chamfer, and dilated fixed pupil. Left eye is stony, hard to touch. What is that?
Painful or no?
Yeah, they have sudden pain, bloody vision, nausea, vomiting.
Yeah. So acute angle closure glaucoma or something like that.
Excellent, that's what it is.
What did they exactly call it? Because there's like a different long name for it.
Yeah, acute angle closure glaucoma. You said it perfectly right.
Okay.
There is a primary open angle closure glaucoma. Present, they tell you there is a cupping,
Mm-hmm.
loss of peripheral vision, and it's gradual, not sudden. Wow, like these things, they used to be very tough. Like took time. Now, it's very easy. Like from repeating them so many times. Yeah. Okay. Now, if you are a 32-year-old male with right eye pain and discharge, and you use extended wear contact lenses. Now you came to me with corneas edematous, hazy and ulcerated, and there's extensive scleral injection. What is going on here?
It's an infection from the contact.
Yeah, it's a Pseudomonas keratitis.
Mm-hmm.
So, what is the first thing to do for a guy who have a sudden pain and redness in the left eye with photophobia, nausea, and severe headache? When you examine him, non-reactive, mid-dilated left pupil.
How old?
62. So you do, this is angular closure glaucoma, you knew the diagnosis. But
Yeah.
now they're asking about management. The first thing you want to do, tonometry
Okay.
to measure the pressure, just to confirm it. Now, it's a good question actually. 67, if you are a 67-year-old male, when I ask you to cover your left eye and look at a small spot on a grid made of parallel, vertical, and horizontal lines, you describe the vertical lines as being bent and wavy. So, what's going on with you here?
I don't know. How old?
67?
Maybe 67-year-old. Something going on with the eyes. I don't know. What would cause them to be something with the cones and the rods, I think.
Yeah, this test is typical for macular degeneration
Hmm.
when they see the vertical lines wavy. So
Mm-hmm.
that's the thing. Another thing they may give you progressive visual loss. Okay, that's the thing.
In one eye, right?
It can be
Or
in one eye or it can be bilateral too. Yeah, they give you. Yeah, that's a good thing to know. So progressive visual loss. It's a good question. Very good question. Vertical lines being wavy. Now, if you are a 69-year-old male with a progressive bilateral loss of vision over the past several months, the problem only in the central vision, but the peripheral vision and navigational vision is fine. What is that?
um, I thought that was macular
That
degeneration.
is macular degeneration too. That's another way of presenting it. Okay. Yeah, you're right. Now, if you are a 60-year-old woman, you had a surgical cataract in your left eye. Okay, 5 days ago. Now, when I examine your left eye, reveal a
Mm-hmm.
swollen eyelid, edematous conjunctiva, and exudate in the anterior chamber. There is a decreased visual acuity in your left eye after cataract. What is that?
Exudate in the interior chamber,
Mm.
and there's conjunctivitis also
Yeah, yeah.
after cataract. Are you having? Is there any photophobia? No, it's orbital cellulitis.
No, this is called post-operative endophthalmitis.
Yeah.
Another name for a hypopoin. They have
Uh,
after like they after they have like foreign body due to surgery.
okay.
Uh, so the treatment for that, based on the severity, first you do gram stain and culture
Mm-hmm.
for the thing, and then based on the severity, you do it's called intravitreal antibiotic injection
Okay.
or called vitrectomy. Okay, post-operative endophthalmitis. Now, if you're a 65-year-old male with sudden painless loss of vision in the right eye that occurred half an hour ago. When I examine your right eye, I reveal visual acuity of 20 out of 60 with subtle retinal whitening and right carotid bruise here. Wow. Sudden painless loss of vision with carotid bruise. What is that? But how do you treat it actually? Because the diagnosis.
Uh, was there retinal widening or whitening?
Retinal whitening.
Whitening, color white.
Yeah, yeah, white.
Uh, I don't know. They have an emboli going up there or something.
Yeah, yeah, excellent. This is a central retinal artery occlusion So you
Yeah,
treat it with
correct.
ocular massage and high flow oxygen.
Yeah.
Now, if you're a 50-year-old male with nodular, painless, rubbery lesion on the eyelid without any discharge or redness or other abnormalities. So how do you think? How should I do for that?
So it's on top of the eyelid, nodular, painless.
Hmm.
Nothing. I think you leave it alone. It's a sty. It goes away. Is it a sty?
So this is called Callison. It's chronic granulomatous condition. So the
Mhm.
best thing to do, we do biopsy because,
Really?
yeah, because it's increased risk for sebaceous carcinoma.
Mm-hmm.
You know, the eye is crazy. Like it's
Oh, yeah.
so many things. Yeah, yeah. Like I had my uncle. He to do. He did ophthalmology like 5 years just to
Mm.
study the eye and stuff. And
Yeah.
then he
They
said,
make-
he said like if someone doesn't believe like in God existence or something, you just have to study the eye and he'll be amazed of
Yeah. Oh,
the things.
they're
It's so
very
crazy. Yeah, and
small
then yeah, and
thing.
yeah, and then now he's doing fellowship in retina only. And he's just
Wow.
like
How long is that?
two
That fellow.
2 years or I don't know. It's crazy.
Crazy stuff. But they make a lot of money. That's for sure.
Yeah, I don't know. Well,
Funny 'cause
he's not here. He's like outside of the state, so he doesn't make as much at all.
oh, well,
Yeah.
I'm sure elsewhere too. You probably make a lot.
No, no, they don't make a lot. He
What?
just do it like because he likes it. It's like the
Yeah, I guess so.
yeah. And you know, like it was funny. Like the first thing I remember, the first time I had a neuro anatomy, I was
Hmm.
this was spent. He was like I think third year board or something. And then I told him, like, what's that? It was the first time I was studying the visual field and stuff. So I told him,
Hmm.
like, yeah, what's in the eye? It's just the visual field. Like the light comes from here, goes in the other side, and get reflected. That's about it. There's nothing, right? And he
Hmm.
started making fun of me. He said, like, I've been studying 5 years for that, and I still find new stuff. Yeah, like
Yeah.
it's not like medicine is crazy. There's so much like to learn.
Yeah.
Yeah. Okay, now another case. If you're a 32-year-old male with examination of the left eye reveal vesicles and dendritic ulcers on the cornea. What is that?
Herpes?
Yeah, yeah. Herpes keratitis.
That's also with the contact wearers, right? Or no?
But it's not on the But it's not on the eye. What is it? Vesicles. Yeah, they can have vesicles, but not on the eye and the skin. What do you mean?
Yeah.
Contact wearers? You said?
Yeah, they can also get this, right? The herpes thing or no?
Not sure.
Okay.
I'll double check. Maybe dendritic. Hmm. Yeah. How do you treat that?
The herpes, I mean, which one? This one?
Yeah, herpes keratitis.
I think you surgically remove it. Not sure.
You know, it's a frequent cause of blindness in the U.S. They treat it
Mm.
with oral or topical acyclovir, antiviral. Yeah, it's called corneal vesicles and dendritic ulcers. Now, if
So
you
what's the cause of it?
hmm,
What's the cause of this thing?
it's herpes virus.
Oh, it
Yeah,
could just go to the eye.
it's a viral infection. Yeah.
Mm.
Now, if you are a 75 African American male,
Mm.
uh, you have a diabetes and hypertension. When I examine you, the fundus reveal cupping of the optic disc. Visual field exam shows constricted peripheral vision. What's diagnosis?
Mm. Constrictive peripheral vision. And what was the other finding? Something you said cupping of?
Yeah, okay, just a second. Sorry.
Just
Yeah, so there's cupping, optic disc cupping, and
uh,
constricted peripheral vision.
cupping. That would, because he's a diabetic and a hypertensive. I'm thinking with diabetes, he has this stuff.
So this is open angle, primary open angle glaucoma. That's how they describe it. Cupping of the optic disc and loss of peripheral vision.
Mm. And it's painless, right?
Yeah, yeah.
Is it sudden?
No, no, gradual. That's a angle closure glaucoma. That's sudden. Now, good question, an easy one. 32-year-old female with knife-like pain that on the face that comes in paroxysm occur 10 to 20 times a day and last a few seconds. What is that?
Yeah, that's not TMJ, but the other thing.
Yeah, it is. It is
It is
trigeminal
TMJ?
neuralgia. You treat it with carbamazepine.
Yeah.
Wow, now fun stuff. I like it. If you are a 43-year-old male with decreased sensation to light touch and pinprick and has hyperactive deep tendon reflexes and an extensor plantar response bilaterally. Rectal exam shows weak sphincter tone. Your temperature is 101. What is that?
Sorry, gonna have to repeat the beginning of this because I missed it.
So fever
Uh-huh.
with hyperactive deep tendon reflexes.
Okay.
What is that? And
Well,
decreased sensation,
where? Decreased sensation where?
like from the umbilicus to the thigh and downward, like umbilicus down.
So lower extremities plus umbilicus.
Right.
Guillain-Barré syndrome. Well, no. Why would you have hyperreflexic
So this
seizure?
is spinal epidural abscess.
Ah.
Risk factor: diabetes, HIV, alcoholism. Okay, trauma, IV drug abuser. They present with a classic triad of fever, severe focal back pain, and neurologic deficit. And they can have progressive symptoms. They can have radiculopathy, motor and sensory deficit, bowel and bladder dysfunction, and eventual paralysis. Management: first you start with CBC, ESR, C-reactive protein, blood culture, MRI of the spine with gadolinium is the most important one. And then you do CT guided aspiration and biopsy. And then you give him peric antibiotic and surgical decompression in the first 24 hours. Very important, because if you don't do surgical decompression, it can cause Cauda equina syndrome and stuff.
So surgery is the definitive treatment.
Yeah, yeah. Now, this is a good one, but I think it's a low yield. So, if you are a 60-year-old male with EEG showing periodic sharp waves, what is that? You
Give
have
me some more stuff.
insomnia, confusion, memory loss, nystagmus, hypokinesia, positive extensor plantar response bilaterally.
What the heck? Is it Brion's disease or something?
Excellent, smart. It's a Creutzfeldt-Jakob disease. They
Okay.
have progressive dementia,
Mm-hmm.
myoclonus, akinetic mutism, cerebellar visual field pyramidal, except pyramidal dysfunction, periodic sharp wave, positive 14. And it's very interesting. Like when I did neurology elective, yeah, I thought that these only we study them, but there are patients who have these conditions like Lewy body dementia and stuff. I remember we had a patient like that. It's very interesting. Yeah,
Yeah.
neurology is very interesting. The only thing downside about it, like there is no treatment. Like you don't. Yeah,
Mm-hmm.
that's not it. Okay, now it's a good one. How do you treat someone with essential tremor?
Propranolol.
What else?
Well, if that doesn't work, then you give them benzodiazepines.
Yeah, or you can give them primidone. So I want you to know this idea. There's a question they asked, is that
Hmm.
they treated a guy for a tremor, and then he
Okay.
developed colicky, abdominal pain, confusion, headache, hallucination, and dizziness. So that
Okay.
was primidone induced acute intermittent porphyria.
Oh, wow. Okay. So first treatment is primidone or first treatment is beta blockers?
Beta blocker.
Okay.
Yeah,
And then
just a
when do
second. Like for example, asthma, and like they survive on the beta receptor. Like if we
Mhm.
block that, that's an issue. So we give them. They had the question. I remember I had a question like essential tremor with asthma. They love to ask that question. So you don't
Mm.
give them beta blocker. Try something else. Now, that's why sometimes we when we see the question essential tremor and we in the beta and then we pick propranolol, we see propranolol and the answer option, we pick it and move on, but we don't pay attention to the other stuff. That's important to pay attention to the other stuff. Like in case they have asthma or COPD, so try something else, maybe lorazepam or something else. Okay,
Okay.
now if you that's a good important question. If you're a 38-year-old male who have a balance problem during the last 2 weeks and you have muscle stiffness with 3 near falls recently, okay, and you have, so now when I examine you, you have resting tremor in both hands, finger tapping is slow and irregular bilaterally. So
Irregular bilateral what? Finger tapping.
yeah, so what is that?
He's only 30A.
Yeah, and you're taking risperidone for bipolar.
Oh, EPS.
Yeah, this is secondary Parkinsonism they call.
Yes.
So it's again cause very. Okay, let's do one more. No,
Hey,
good
have
question,
you
huh?
heard there's a lot of psychiatry in step 3 or neuro?
No, I never heard of that. Did you hear about that?
No, I was just wondering.
No, I haven't heard of that.
Okay.
Actually,
I
yeah,
hope
but
it's not on neuro because that would be horrible.
what? Yeah, I think they would. It would be balanced.
Okay.
Yeah, that's how I think. Like it's a software, so it would be balanced. They're gonna ask about everything. They got plenty of questions to ask. Now, good question. If you are a 76-year-old woman with occipital headache and difficulty walking, so what should you do right now? First thing,
She's 76 and she can't walk.
yeah,
I,
occipital headache, confusion. So you want to do CT without contrast, right?
yes.
Yeah, so that's the main thing. Let's do a really quick, rapid review because, and then we'll continue later because I was supposed to start like earlier. Now, let's just do rapid review.
Are you living at home these days with your sister or with your parents?
Yeah, so let's just do rapid review.
Hmm.
Sodium bicarbonate for TCA poisoning.
Hmm.
Remove clothing and wash the body for any intoxication, especially organophosphate. CO poisoning, have pink skin. 100% oxygen for CO poisoning. Benzodiazepine overdose can cause slurred speech and lethargy. Black soot in the mouth, that's a cyanide, not a CO poison. If you have sudden pain in the eye with mid-dilated pupil, that's a glaucoma. If you have contact lenses, you may have Pseudomonas keratitis. Macular degeneration for central visual loss. Cataract surgery can cause post-operative endophthalmitis. Glaucoma treated by high-flow oxygen. No, sorry, the central retinal artery occlusion. We got a biopsy the nodule in the eyelid due to risk of carcinoma. Carbamazepine for trigeminal neuralgia. Spinal epidural abscess present with a fever, back pain, neurologic deficit. Creutzfeldt-Jakob disease present with periodic sharp waves on EEG. Primidone can induce acute intermittent porphyria. Finger tapping in a young guy who's taking risperidone, that's most likely Parkinsonism, secondary Parkinsonism. Last but not least, if you have occipital headache, confusion, that could be hemorrhagic stroke, so we gotta do CT without contrast. Okay, and that's the end. Okay.